Good afternoon. My name's Dr. Fleur Cattrall. I'm the Medical Director of Melbourne IVF. And today I'd like to talk to you about embracing your fertility over the age of 40. So when women and couples find themselves over the age of 40 and planning a family, rarely do they intend to be in this position. Often it's because they didn't meet the right person until over the age of 40, or they perhaps were with the wrong partner for a long period of time. It just took a long time to find that right person. Or they decided that, well, they probably weren't going to meet someone and they really need to, they're feeling that biological clock ticking, and they need to embark on alternatives such as donor sperm to conceive. There are some actual advantages to having your family over the age of 40. Now, I'm certainly not saying that you should wait, but why not think about the positives that you find yourself in this situation? So the reality is most people are more financially secure in their 40s. And you are older and wiser, so the things that you have learnt through your lifetime can translate into positive parenting outcomes. And it's less likely that you're going to feel like you've missed out on a lot of things by having your children young. And the interesting facts are older mums actually live longer, and children are actually taller and smarter. Now, we all see celebrities conceiving over the age of 40, and I think that gives the impression that if you look after yourself, then your fertility will too. And there are many big names that have had babies in their 40s, and quite recently, Naomi Campbell. And they're often very beautiful women, clearly take care of themselves. And that perpetuates that myth that if you look after yourself, your eggs will be preserved. But as a fertility specialist, when we see these stories, we think to ourselves, did they really conceive did Naomi really conceive naturally at 50? Because we see these things so rarely. We also think, did she actually freeze her eggs? So did she use 40-year-old eggs that she froze and use them at the age of 50? Because it's the age of the egg that's important in determining the chances of pregnancy. If the uterus is healthy, that's not a factor. The age of the uterus is a very minor contribution. Or did she use donor eggs? So the age of the egg determines the chance of pregnancy. So if you have a 25-year-old egg in a 50-year-old uterus, the chance of falling pregnant is as per a 25-year-old. And there are other options. So, if she was a single woman that needed donor sperm, that raises the possibility of maybe a donor embryo might be an option. Sometimes that's from a friend, sometimes that's from a couple that have completed their family and are willing to donate their embryos to another person or couple. And, did she use other options? Did she use a surrogate? Did she actually carry the baby herself? So I guess fertility specialists have a different view when we see these articles in magazines. And often there is no backstory that is given by the celebrity as to actually how they conceived. And the reality is, each month over the age of 40, the chance of falling pregnant declines. So at 40, the chance per month is only about 7%. So roughly 1 in 10 months might someone conceive. And that's because the egg quality declines. The eggs, big cells, they accumulate DNA damage as you age, and it's harder for an older egg to get the genetics right in an embryo. And the egg quality declines, the egg quantity declines, and the miscarriage rate increases. And 1 egg is produced per month. So we only have that one opportunity per month. on the left there, you can see normal ovarian tissue in someone of reproductive age. And there's lots of little round circles there, which we refer to as the eggs. And each month, one of those is chosen to ovulate. And the normal process in the ovary is the eggs that didn't get chosen, they slowly die, and then you get a new batch of eggs waiting for one to be chosen. So the point there is there's this constant turning over process in the ovaries. So although there's thousands of eggs in the reproductive age, only 400 will be released in a lifetime. And this slow turning over process means that some women that egg number will decline at a different rate. So some women will have what we call high ovarian reserve and lots of eggs, and some will have low ovarian reserve. It's very hard to predict when they're going to run out of eggs, which is sort of the bottom left picture on the screen there. And it's very hard to pick the fertile time when the egg that's released once a month only lasts for 24 hours. But fortunately, sperm do last a few days. So that's where the concept of having sex at least every couple of days means that there's sperm around at all available opportunities when the egg might be released. So it's not that you need to save up the sperm, it's just that it will last. So that's where that concept of having sex every couple of days has arisen from. The average age of menopause is 51, but the reality is the eggs are no good long before that, but it's very hard to predict which age it is that you will no longer be able to conceive. One of the things that you can look at is cycle length. So in a younger woman, they tend to have 28-day cycles regularly. And as they get older, that cycle length can change. And sometimes it's the first inkling that menopause is still years away. But if the cycles start to get shorter every 23, 24 days, that's probably the first suggestion that eggs are running out. And then it will be several years before there might be 3-month cycles with 6 monthly cycles until the official definition of menopause is reached, which is no period for 12 months. So we need to find that golden egg. And if many months the eggs are no good, we really need to maximise our chances each month when the egg might be released, hoping that that egg will be able to achieve a baby. And the chances matter and they add up. So on this graph, you can see the green line is for women aged 40 to 43. And it shows the chance of pregnancy over a 6-month period, and then a 12-month period, then an 18-month period. So at 12 months, about a quarter of women in that 40 to 43-year-old age group will have fallen pregnant naturally. So rather than be disheartened by this, I think it's just good to have the knowledge that, well, there is a chance of pregnancy and the chances add up. And so that's what we refer to as a cumulative pregnancy rate. So each month you get more and more in the pregnant group and less in the not pregnant group. And psychologically, I think you need to view it as you're moving closer to your goal to have a baby. So trying naturally does lead to pregnancy over the age of 40. However, miscarriage also happens. So in a 25-year-old, only 1 in 10 will fall pregnant, but over the age of 45, it's more like 6 out of 10. So it's not just the getting pregnant hurdle, it's the staying pregnant hurdle. So it's a series of steps to get to your goal of having a baby in this age group. You are born with all your eggs, and you can't make them any younger. All you can do is put yourself in a position where you can have a baby as soon as you are able, get the knowledge you need, and make the most of your chances. If you get to positive pregnancy test, that's a really good sign in someone in this age group. It actually puts you in a better prognosis group to ultimately be successful in having an ongoing pregnancy. Next hurdle is seeing a heartbeat on ultrasound. That improves the chances even more. It probably means that the baby's more likely to be genetically normal rather than lead to a miscarriage. The next hurdle is doing that that genetic screening about the 10 weeks of pregnancy, when you can do a blood test to look for baby's DNA in your circulation to confirm that it doesn't have things like Down syndrome. So you don't have to view this as a dead end when you're over the age of 40, but there are challenges. And it's really important to manage that psychological piece related to what we hear about conceiving over the age of 40 and keep moving forward because at the moment in this journey, there's no evidence for you that it won't happen. So knowledge is power in my view, and you do need to know your normal cycle. So at ovulation, the egg gets picked up by the fallopian tube. Little fibres beat the egg along until the sperm meet and penetrate the egg. At that point, normal fertilization has to happen. Now, this is all beyond your control. No matter what you do, you're relying on that good egg being present and then implanting into your uterus. So there's only so much that you can do in this situation, but you can make sure that you check everything early. So knowledge is potential, action is power. So on that, check everything works early. See a fertility specialist or even your GP initially to confirm the basics. Are there eggs? Is there sperm? Is there normal anatomy? So are you ovulating? Do you know when you ovulate? Are you having sex at the right time, which we say covering the fertile time? And there's lots of different ways to do this. The apps, and there are many, and hard to pick which one to use, but the basic concept there is that they will give you a range of when that 1 egg per month is likely to be released. Another common one in that top right-hand corner there is basal body temperature. Now, this is a good test to confirm that you ovulated in retrospect, but what you really want to know is you want advance warning when that egg will be released. So the urine ovulation tests are the best because they will become positive due to what we call luteinizing hormone the day before the egg's released. Now, the simple, cheap tests are probably just as good as the more expensive ones that link the urine test analyzer links to your phone by Bluetooth, and they give you great graphs. But all you need to know is when is that luteinizing hormone present, and then you need to have sex that day, the next day, and the day after. So be proactive, write it all down, get help early, know when you're ovulating. Is there a pathway for the sperm and the eggs to meet? They've got to be able to meet each other, like that animation I showed you before. So one test is to put fluid through the fallopian tubes and confirm that they're open and not blocked, and they don't have things like inflammation, salpingitis, or a dilated, inflamed fallopian tube, or a condition called endometriosis, which can block the fallopian tubes. Are there good swimmers present? So does your partner have good sperm? And the reality is, if you're an older woman, there is a good chance that you're probably coupled up with an older man. So men over the age of 45 do have reduced sperm quality. So they might have sperm that are not the perfect shape, or the numbers might be reduced. And it's a little bit harder for those sperm to swim as a group to get to their destination and find the egg. And then it's harder for them to get into the egg. And therefore, it does tend to take longer to achieve a pregnancy when the sperm quality is not perfect. So get that checked early and see your fertility specialist and you may need to think about fertility treatment early. So basically take charge of your fertility. Get a good family doctor that can do all your tests and support you. Check that you are healthy. So if you're an older mum, then, and a father too, it's important that you aim for optimal health. And you check those common conditions that increase as we all age. So blood pressure, heart, kidneys, aim for a normal weight. Check the things you can check. Are all your vitamins normal? Have you had a pap smear test recently? Are you on the appropriate medication? So if you're taking herbal supplements, they need to be reviewed. If you're taking other vitamin tablets, they should be reviewed. Do you really need them? Are they going to help you? Get vaccinated. So early on, you should be thinking about confirming that you're immune to rubella and chickenpox, because these can cause birth defects in pregnancy. So even if you're not quite in a position to have a family yet, you could be doing those things, because if you find them out just as you're beginning to try, you can't fall pregnant for another month after you've had those vaccines in particular. COVID, we want everyone to be vaccinated, and the college guidelines, which were released jointly with the Department of Health guidelines, say that the Pfizer vaccine can be given in pregnancy. So look them up, consider vaccination, particularly if you live in New South Wales at the moment. I'm in Victoria, so we're good right now. So start a pre-pregnancy multivitamin, something like folate. The minimum dose is 400 micrograms. Some supplements do have more than that, but the evidence is around 400, so that is the minimum. Pre-pregnancy genetic screening, to look to see if you're a carrier of genetic conditions, can be done. So are you a cystic fibrosis carrier? 1 in 25 people are. If your partner also is, then 1 in 4 of your children would be at risk of this. So you can ask and decide whether or not you want to have that pre-pregnancy genetic testing, which is different from the testing once you're pregnant to test that baby in particular. For genes like cystic fibrosis, we need to test the parents at this stage of medical science. And then based on the risk, then we test the pregnancy. Stop smoking, alcohol, drugs. Pretty obvious. Limit caffeine, 1 or 2 a day. Not a big problem at 1 or 2 a day. If you're an older person, then you're probably going to have a higher risk of medical conditions in pregnancy. So consider getting the best possible pregnancy care, private health insurance, so you can have the same experienced doctor throughout your pregnancy is a sensible thing to consider. Aim for optimal health. I'm a big fan of, rather than taking a lot of not evidence-based supplements, to focus on a healthy eating pattern. So a wide variety of healthy foods. So eat the rainbow. Wash your food to remove pesticides. Maybe eat organic. Minimally processed foods. Some protein and vegetable sources, from vegetable sources, I should say. More whole grain foods, less sugar, less junk food, milk or alternatives. And deep sea fish it does contain mercury, so we kind of vary the fish varieties up and avoid things like swordfish. And if there's any doubt, there are fertility dietitians that you can see to review what you're actually consuming and see if you can make any changes that will support your fertility journey. Again, these things are to support your journey. So you can reduce your risk of endocrine disrupting chemicals by not heating your food up in plastic containers, not using plastic water bottles, avoid unnecessary chemicals in things like aromatherapy, essential oils, household chemicals, careful when you use pesticides in the garden, paint fumes, personal hygiene products that contain endocrine disruptors such as parabens. Now, this is sort of new emerging evidence, but it is something that you can do to take charge of your fertility. And it's not going to be as miraculous as you stop using a plastic water bottle and then you'll get pregnant. You're just supporting yourself and making sure that you're optimal health. Of equal importance is to get plenty of sleep, look after yourself and your partner. If all else fails, so trying naturally, you got all your fertility assessments early, you did your fertility treatment, and I haven't focused a lot on IVF in this talk because I'm sure you've had other talks during the day. But, you know, IVF to get more eggs at once before you get older is a way to address age-related infertility. So if you get 10 eggs, it's a little bit like 10 months of trying. You're sifting through them faster. It would not be until you've been through all those things that maybe you might know whether or not you'd be in a position to consider a gift from someone else in order for you to have a family. So by that, I mean a donor egg, a donor sperm, a donor embryo. So because female age is the most important part of the equation, particularly in women over the age of 40, a donor egg is the most common thing that we, as fertility specialists, think about should everything else not be successful. Now, the urgency about fertility in this age group is about, is it possible to conceive with your own eggs? So that is where the urgency is. You need to make the most of your own eggs every month, do the fertility treatment you need to do. However, if you are then at the point of mind where you would consider a donor egg, that time pressure is off, as long as your uterus is healthy. Now, we can use donor eggs up into the age of natural menopause. Yes, there's increased risks of pregnancy as you get older, but the chance of pregnancy is related to the age of the egg. So that time pressure is off. So maybe if you've finished your fertility treatment, you take a step back, a few months of just considering, would I consider a donor egg at this point? And so on that note, I guess my point is that every fertility journey is different. There's no right or wrong pathway here. You need to do what you feel is helpful for you. Get the information that you need to make the choices that are right for yourself, because everyone is different. So it's going to be okay in the end. And if it's not okay, it's not the end. So I would just leave you with that thought. Thank you very much, everybody. Hopefully that gives you a little bit of a different perspective on conceiving over the age of 40.
Thank you so much, Fleur. That was great. Now, you know, speaking to someone who is over 40 and still on, you know, trying for my second with IVF. So, you know, that's really informative. And it's good to hear that, you know, yes, the statistics say that, you know, my chances are slim, but it's not impossible. And they're just stats, and, you know, everybody's unique and different. So
yes, and thank you, Ella. And a point for yourself, obviously, is if you've been successful, you know it works, and you're more likely to be successful a second time.
Yeah, absolutely. I keep my dream alive. So I have some questions, and if anybody has some questions, please put it in the box. This is the last session. and we will be closing at 5, so get your questions in, please. So I have a question. I have frozen eggs from when I was 35. I'm now 42. How long can I wait until I use them?
Well, if you're in a position to have a baby right now at 42, so you've got your partner, and it's a choice between getting married or buying a house or having a baby, have a baby now and worry about those things later. So if you've got yourself into that right position where you can have a baby, do it now, even though you've got those 35-year-old eggs frozen. And the point of that is, although they're not going to change in time, you want to know whether or not it's possible to conceive with your own eggs at 42. And if it's not, you're still young enough that you could get more eggs at 42, or you might fall pregnant naturally and keep those 35-year-old eggs for your second baby.
Oh, yeah, that's a good point. Yeah.
Mm.
So I have a 32-year-old friend who is planning to donate eggs to me, but I am 48 years old. Will my age affect its chances of success?
Well, I guess the most important thing is to get advice early. And that's wonderful that you have a friend that's willing to donate your eggs to you. At 48, if you're healthy, no medical problems, and your uterus is healthy, it doesn't have other medical conditions that can affect the quality of the uterus, then the chance of pregnancy is per that 33-year-old friend. And so it would be very possible for you to have a baby. Of course, that you would be going to a fertility clinic and have all the counselling to make sure that it's the right thing for your friend and it's the right thing for you and your partner.
Excellent. I've got another question. They are coming in, so that's great, everyone. What do you think about going back to back with egg collections when you're over 40 to reduce delay and to increase the chances of healthy embryos?
That's a really good question, actually, and you will get different advice on this. A lot of the evidence would support a back-to-back cycle. However, if you're someone that can make a lot of eggs, you know, if you can make 20 eggs, and there are some 40-year-olds that can do this, it will be hard to get 20 eggs a second time back to back. But if you waited just 1 month, that will allow that baseline ovarian reserve to reform and the ovulation sites to settle sufficiently that you possibly have an opportunity to get a similar egg number the next month. But if you're someone that makes less than 5 eggs per month, back to back is usually okay. There may be some months where you get less eggs. You know, sometimes if you go back to back a few cycles in a row, you'll start to get less eggs. And it's always a little bit hard to know because, you know, there's so much biological variation in the numbers with IVF. So you might see someone that 1 month they get 5 eggs, and the next month they get 2 eggs, and the next month they get 3 eggs, and then they get 6 eggs. And it's nothing to do with the time frame, it's just the biological variation. So I think that's something you would need to discuss with your fertility specialist.
Interesting. So I have another question. My husband is 50 and I am 40, and we haven't started trying yet. Will his age be a problem conceiving?
Yes, so over the age of 45, men's sperm quality does decline. So it does take longer to achieve a pregnancy. The other issue is that of those babies that are conceived from older men, there is some evidence of some increase in some conditions such as autism, schizophrenia, some autosomal dominant disorders such as dwarfism. They're very just slight increases around the background rate. But yeah, it is a factor. And it would be something where you really, if you're in the right position to have a family, then you'd be considering doing all your pre-pregnancy tests first, getting his semen analysis checked, and getting advice early.
Okay. Now I'm over 40 and I have one blocked tube. Is my chances of conceiving naturally 50%?
It's actually not quite 50% according to the literature. It's always been a bit perplexing to me why it wouldn't be 50%. I mean, the concept that we're given is that the egg can travel to the other fallopian tube. So that, statistically speaking, it's not halved. It's a little bit more than half. Another thing that it's a bit of a misconception actually, that ovulation alternates. And so there are some people that would mistakenly think, well, my right fallopian tube is blocked, and the ultrasound 1 month showed that I ovulated on the right, so therefore I know that left is good, and then right and left, and they'll time assuming that alternation happens. But in fact, what can happen is you can have a couple of ovulations on the left, and then one on the right, and then 3 on the left, and it doesn't actually alternate the way you think.
Okay. Now, when you're going forward for IVF, and you yourself was talking about lifestyle and the impacts of your lifestyle around you, smoking, drinking, taking drugs, etc. Exercise is one of them, and BMI also. Now, is there a particular BMI, an optimal BMI weight for someone to go forward with IVF?
Yes, so over a BMI of 35, you certainly start to get a reduction in pregnancy rate and increased risk of miscarriage rate. Certainly be advocating for a fertility specialist consult that involves an obstetrician review, and probably some support from the GP, and a plan in terms of how you would optimise your weight prior to pregnancy. But yeah, I mean, normal BMI, of course, is 20 to 25, and that's really where we'd ideally like people to be in. In reality, they're often not in that range, and I think people need to do what they can to get into the best health they can, despite being in an overweight position.
Okay. So if you have had IVF and you're over 40 and you've had embryos that are not implanting, what would you say is your next port of call? Would you say genetic screening for those embryos if you're going through another round? What would your suggestion be?
That really is a discussion with the fertility specialist, depending on what has been learnt from the treatment that you've had. So sometimes people have miscarried, and you've had the opportunity to test the pregnancy, and there might be several miscarriages that are related to chromosomal issues, and couples will often elect to test the embryos in that situation, mainly because they don't want to go through another miscarriage. For those people that have not fallen pregnant despite lots of embryos transferred over the age of 40, as fertility specialists, we certainly suspect that the reason is related to random chromosomal errors in the embryos. However, you can't make that assumption without excluding all the knowable things. And so that means testing. So doing all the testing that we can do to see, is the lining of the uterus normal? Is there any inflammation, infection, immune problems? Is there any systemic medical conditions that could be affecting implantation before you make those assumptions? It's not a straightforward question regarding the testing of embryos. However, if you're someone that can make a lot of embryos over the age of 40, you can sift through them faster with genetic testing. So you can save yourself a lot of time. But most women over the age of 40 don't make a lot of embryos. So if they're only making 1 embryo per month, they may elect to just, or per treatment cycle, it may be just as sensible to implant it. It is useful, I think, as time goes on, if IVF is not successful, to do the testing of the embryos at least once for couples, because it actually can show them black and white what we suspect as fertility specialists. So if we test that 1 embryo and it has an extra chromosome 18, we can say to them, well, you know, that the embryo wouldn't, well, that particular one might have implanted, but some errors they definitely wouldn't have implanted. And the you know, we sort of infer from that a lot of those other embryos that weren't successful might have had similar issues. Mm. So you build a picture with time. I think it's an ongoing assessment in terms of, you know, what have you learnt through the treatment if it's not been successful.
Mm. Those women who are able to produce 20 eggs, I would say that's their superpower.
Yes, that's true. That's a positive way to look at it. I was thinking I was getting a little bit negative in this conversation. It's often the case, but you know, you can get pregnant on all sorts of egg numbers. I think I'd like to say, you know, there are people, and you know, see many of them, they'll have 1 egg and 1 embryo and they're pregnant, and there'll be people with 20 eggs that only end up with 1 embryo. You know, I think the thing is, you just don't know until you've gone through the process where, you know, what your story will be and what you learn from that, that will guide you to the next step moving forward.
Yeah. Okay, anybody have any more questions for Fleur? I think we don't. Okay, well, it's been great. Thank you so much for talking to us and, you know, and your knowledge. And if anybody, no problem. If anyone has any more questions for Fleur, or please, you know, head on to Melbourne IVF. That's where the clinic that Fleur works with, and you're able to get hold of her by just directing a message, or yeah, you can talk to the girls. So Fleur, thank you so much for your time, and stay safe.
Pleasure, and same to you, Ella. All the very best, and I hope things settle down in New South Wales very soon.
Yeah, absolutely. Thank you. Take care.
Okay, bye.